welcome to Digital Health Talks, where we explore cutting-edge healthcare innovation. I'm your host, Megan Antonelli, founder and CEO of HealthIMPACT. Today, we're diving into a critical area of opportunity and challenges in the digital health landscape. My favorite, the employer market. And with us is Lindsey Kratzer, CEO of Spark Health Advisors, an expert in helping healthcare companies navigate and succeed in this complex ecosystem. Whether you're a startup looking to break into the space or established player seeking to optimize your approach, this conversation should provide valuable insights to drive your growth strategy. Let's jump in and uncover the ways to winning the employer healthcare market. Hi, Lindsey. How are you today?
Doing great. How are you today, Megan?
I'm great. It's kind of a cloudy day here in Hermosa Beach, which is, supposed to be unusual, but we've had a bit of a cloudy summer. So hopefully my listeners don't get sick of me complaining about my Southern California wedding.
Yeah, exactly. You're still in Hermosa Beach. So,
yeah. Come January, it shouldn't be too bad. How are things for you? I think I've always been so interested in kind of the stakeholder piece and the incentives of healthcare. And so I'd love to hear kind of how you got, into the healthcare innovation space and what was your pathway to here?
Yeah, absolutely. So I started off my career, more in the consulting space. But I've always been interested in healthcare. I grew up, like, my mother's a registered dietitian. I benefited a lot from just having like healthy lifestyle for a long period of my career. And I lived in Nashville for a long time, which, if you're not working in healthcare, like, that kind of drives that market, right? So got into the healthcare space and have spent most of my career really working with employers. So that's really kind of where I've ended up focusing my time and effort within the space.
Yeah. Well, the employer market, it is it's such an interesting and, of course, diverse market in terms of, how they get involved in healthcare and how they purchase it and look at it. And, I've always been interested in how it's ebbed and flowed, right? And I feel like there's certain points of, this, last 30 years that I've been in healthcare that employers have been super engaged, and it's been a very big policy discussion around cost and what can we do. And I feel like in some ways that's coming back. And I think I've read somewhere, it's, for the digital health companies that the employers represent, a $600 billion opportunity. It's very big, but it is also very complex. So tell us a little bit about, what you see as the big challenges that digital health companies should be thinking about when they're selling into the market, and kind of, maybe a little bit of the opportunities.
Yeah. Yeah. I mean, I think you're right. It is complicated, especially for these digital health companies. There's been an influx of vendors. I think everybody's heard the term vendor fatigue at this point. But these HR teams at these employers are kind of overwhelmed with different point solutions that don't necessarily integrate well into their ecosystem. So I think we're seeing more and more of a trend towards companies looking for more holistic solutions that can solve a bigger chunk of their problem. And they also have small HR teams typically. So, even a large employer, the expertise that they have in-house to evaluate different benefit solutions and manage, a ton of different point solutions, they just don't necessarily always have that in-house ability to do all of that. So I think that's a challenge. But on the flip side, there are more and more companies that are getting into the self-insured space. You're seeing smaller and smaller companies starting to flip from fully insured to self-insured. I think that there's just dramatically rising costs of healthcare for employers. And I think they are kind of reaching a breaking point where, this is like oftentimes the second largest cost for an employer after labor. And they're looking for ways to mitigate those costs and bring those costs down. And then also, I think that a lot of employers are looking to distinguish themselves as employers of choice, and offering, best in class benefits is a really important way to do that. So while I think that there are a lot of challenges that employers face, I do think they're still looking for innovation as well.
Yeah, absolutely. Tell us a little bit in terms of the self-insured employers and that growth in in that space? Like how quickly is it growing? How much do you see that change happening? And what does the profile of those types of companies look like?
Yeah, I mean, I think that the large organizations like the Fortune 1000 have obviously been self-insured for a long time. As I mentioned, their costs are continuing to grow. So, it's becoming more and more of a burden for those organizations. But as you move more like down market, more and more of those companies are starting to be self-insured as well. I think like the total self-insured population in the US is over like 100 million people that access care through kind of a self-insured employer plan. So, I mean, it's a ton of people in the United States, and we're seeing companies as small as 500 or less that are really truly mid-market companies that are moving into the self-insured space, but they don't necessarily have that in-house talent or knowledge of how to navigate that space. So a lot of influencers like brokers and other aggregators play a really important role for those companies.
Mhm. Yeah, no, absolutely. And it is, I mean, as they are self-insured, and you mentioned sort of the point solutions. And I think that's another thing that we're seeing across digital health, but not just from the employer perspective, but from the patient perspective, right? I mean, I'm going to go to One Medical for my primary care, and I might go to Hims and Hers for my other things, and I might go to Winona for some other things. And there's, I mean, it's starting to, those digital solutions are, and then I'm managing my, sleep with my Aura Ring and my fitness with my Apple Watch. There's a lot of sort of those different, tools and applications. How are the employers kind of handling that? And what do you guys do to kind of help that?
Yeah, I mean, I think that kind of the first step for any solution is really like figuring out like why are you here and how are you going to add value for the ultimate consumer of the healthcare, which would be the employee and their family. So kind of what we talk about is like the member. So you have to have a distinguished value proposition and differentiators and really think about like why you're here, how you're creating value for them. Because if they're not going to utilize your solution, you're never going to be successful with employers to begin with. So we work a lot with companies to really help them think through their differentiators, not just by the B2B buyer type, but really how they're going to operate in this B2B2C environment and how they're going to engage kind of the ultimate consumer of the healthcare and how they're going to create value for those people.
Mm-hmm. Is it a lot of like, more of a push pull? Like, do you feel when it comes to the digital health solution,
Mhm.
does it matter that the employees are asking for it? What's the best way when you're talking to these employers, sort of what are they looking for in
Mhm.
those solutions? What gets their interest?
Yeah, absolutely. I mean, so there definitely have been a lot of companies, and we talk to them all the time, that started with more of a D2C approach, so more of a bottoms up approach, and they're trying to prove out kind of the value with kind of the healthcare consumer, and then kind of move into employers next. That certainly is one way to do this. But I think when you're thinking about the employer, they're typically looking for outcomes, right? So outcomes could be cost, it could be quality, it could be, the actual member utilization of the product. So they're looking for solutions that are going to be able to drive outcome and make an actual meaningful impact for their organization. And I think one of the challenges with the point solutions is that, oftentimes they may, be great in one specific area, but, it's not necessarily bubbling up to one of those top concerns of employers like cancer or musculoskeletal or something like that. And so, how do they kind of navigate that ecosystem where they can still sell into the employer market, but they may need to go through other channels rather than just going direct necessarily after like the Fortune 1000? If you're more of a narrow point solution, that's probably not going to work. You're probably going to need to take more of an integrated approach to that ecosystem and selling into them.
Yeah. I mean, when I was sort of in this, it was like, the variety of tools. It was like, a lot of like wellness, yoga, all these sort of
Mhm.
apps. And it's like that stuff, of course, is incredibly important, but does it is it going to affect the cost lever, and
Mhm.
that's where things are. So tell me a little bit, what are you seeing out there that is, really providing that value? What are the types of tools that the employers are really getting into?
Yeah, I mean, I think to like build off of what you're saying about wellness and yoga, like, I mean, I love yoga. I think it's like fantastic, but like it's hard to like prove out an ROI on a solution like that for employers. So obviously, if you have a product that can deliver a hard dollar ROI, that's going to be, kind of the ideal type of solution to bring to the employer market. But I think there's other ways, to kind of prove out value to the employers too. So if it's something that there is demand for within the employee population that they're going to utilize, that can certainly be something super beneficial as well. So I think that there's just different ways to kind of tackle that. In terms of solutions that are, picking up speed right now, I think everybody's concerned about like GLP-1s and the increasing cost there. So a lot of talk around weight loss. I've had a lot of conversations around that. I think pharmaceutical costs are, increasingly becoming overbearing for employers. So they're looking for alternatives and different solutions and ways to bring down those costs. Cancer remains, really top of mind for employers as well. So they're looking to invest in different, solutions that are going to help manage kind of their cancer risk. I'm passionate about women's health. I think that women's health is really exciting, and it seems to be picking up tremendous amount of steam. I think a lot of like women, like both of us, are like, at an age in the workforce where, their employers really want to retain them. They're key decision makers in the organization. So, providing resources that help women, family planning, things along those lines, I think are really picking up steam. But I think that the narrow point solutions can still deliver a lot of value. They just have to figure out the right way to work into that employer's ecosystem. And a lot of time that's maybe through partnerships and some of the aggregators that are out there.
Mm-hmm. And what do you think? I mean, as these folks, the innovators are kind of approaching those companies, obviously coming to you for help. But in general, I mean, how do you even engage that conversation? Because I do feel like there's a lot of middlemen, whether it's brokers or, the Mercers of the world, that you don't necessarily get those conversations. How do you, suggest the digital health companies go, to the employers?
Yeah, I mean, I think it depends on the individual company and, what it is they are trying to achieve and what kind of value they can offer. So again, if you're, tackling like a big category of spend for an employer, maybe it makes more sense to go direct if like you can have a more direct impact. But for a lot of companies that we work with, they may have started off trying to go direct to employer and they're not seeing a lot of success there. So a lot of time we recommend kind of a two-pronged approach where it would be, certainly there could be a direct outreach effort towards employers, but also like engaging the ecosystem. So how are you going to kind of engage the brokers and consultants, which, are influencers in that buying decision? If you go to a broker and consultant and you're an employer and you say, what about XYZ solution? They're like, I've never heard of it. I don't think this adds value. That can really impact that decision for the employer. Another way is really to work through, TPAs and different aggregators in the space that can serve as like procurement vehicles. So strategic partnerships that can serve as procurement vehicles for employers. So easy ways for them to kind of add on the different point solutions that they need for their population. So oftentimes, those guys are not necessarily going to go out there and actively sell on your behalf, but it does make the purchasing process easier for the employers. So we recommend oftentimes kind of a two-pronged approach, but it also depends on where you're targeting employers. So do you have a solution that's more focused on like mid-market employers? Do you have more of an enterprise solution? Where are you in terms of outcomes and case studies and what you've been able to deliver today? Like we typically recommend like, don't go after like Disney, like day one, right? Mm-hmm. Probably not going to get very far with that approach.
Right. Yeah. And I always thought, I mean, not to the conferences and sort of the places that the employers do go. I mean, there's a number of those events they do in some ways. I always felt like they divide them up very quick, very well in terms of, you have the self-insured markets that go to certain events. And then there's certainly a number of healthcare benefits events too. I don't do any more of them myself, but I remember them being quite robust. And then even just the HR events themselves and like the regional HR programs, it's very interesting to see like who goes there and what they are talking about when it comes to healthcare, because it's often very different from what people are talking about at the digital health type conferences or at the health IT conferences, certainly at HIMSS, I mean, it's a really big chasm, I think.
Yeah, I agree. I mean, we work with a lot of clients that are looking for recommendations on which conferences they should invest in, because like it can get very, very expensive, right? And you need to have kind of an event strategy. You need to make sure that you're going to like make the most of those different events. So which ones would be kind of the most important for them based on their audience? Are they going after more brokers and consultants? Then maybe SIA makes sense. If they're going after large employers, maybe more National Business Group on Health makes sense. So really kind of helping them to kind of understand what are the different options there, and what are some different avenues to kind of get in front of employers or kind of those decision makers within the ecosystem they need to work with. But I mean, I think regardless, you need to have an event strategy, because you can pretty quickly spend, in the six figures or more on events, and you may not really see the return on investment for that.
Yeah, they go to their events is the reality of it, right? I mean, and it's hard. I worked for years trying to get them there, but it's hard to get them to come to an event that's about healthcare or IT specifically. I mean, that's not that's not the angle that they're coming at this from,
Yeah,
So.
I think they oftentimes, especially like if you're working with the employers, they oftentimes like to like be at events where there's a lot of peers too, so that they can like learn from other organizations and how they've tackled things and really do that networking and building those connections. We've had quite a few clients that have kind of put together their own events where they're bringing like employers that are within their ecosystem, so either existing clients or prospects, and trying to kind of pull them together into events. So those seem to be successful as well, because I think, again, there could be like that peer sharing. But even for companies, when they're looking to do webinars and things like that, we typically recommend, hey, like you should bring a client on here and have them do most of the speaking, rather than, you out there trying to like pitch what your company's doing without kind of the backing of the employer to validate that.
Right. Well, that is a universal truth, across all of the digital health vendors, whether you're selling into the employer or the payer or the hospital market. But I think with the employers, it's that much more important, because I think that one, not only do they feel as though they come at it from a unique place, but they're also a very diverse group. So whether they are, as you said, Fortune 1000 to mid-market to small employers, their needs and how they look at healthcare is completely different. And I think it's very easy for digital health companies to make the mistake of just thinking of, oh, it's the employer market, we're going to go after them. It's similar to the consumer market, but they're employers. Or it's similar to the payer market, we have to provide value, but it's we're going to be talking to HR people instead of actuaries. So,
yeah, we see that all day long. We run into that pretty consistently, where companies are taking the approach of like, oh, this is just like another, market we're going after. Like, sure, we haven't done this before, but like, how hard can it be? And what we find is that you can certainly take that approach, but it's probably going to take you quite a bit longer to see the results, rather than bringing in, experts that understand the ecosystem. So whether it's somebody like us or bringing in in-house talent, I think that bringing in somebody that's worked in that employer specific space is really smart. We spend a lot of time educating companies as well on the different types of buyers within the employer world. So certainly kind of the influencers in the space and the procurement vehicles, like I mentioned, but then also the different types of employers. So to your point, it matters like the size of employer. But even within the Fortune 1000, a manufacturing company is going to care about very, very different things than a tech company that's in a major market. Their employee populations and the people on their benefit plan are going to differ very, very much. So you don't want to go into a tech employer talking about diabetes and, aging population types of concerns, chronic conditions. Like they're going to be like, we don't see this in our organization that much, but you really need to have a tailored approach to what's going on in that population. So we work a lot with companies to identify like what should be kind of their ideal client profile, and then how to navigate the world to get to them.
Yeah, that's so important. I mean, it's so different, and the needs of each employer are different, which is what makes it as challenging as it is. In addition to, the number of other elements of the fact that it's only here on their priority list versus here, depending on the type of organization, for sure. Talk a little bit about, so we've heard, and I've seen a lot of discussion around PBMs lately, and there's certainly been there's a lot of competition in that space. And that's, as you said, one of the bigger drivers, with the escalating costs and demands for GLP-1s and everything else. Are you seeing any movement in that space? There's always a call to sort of get rid of PBMs,
Right.
but whether or not that will, ever materialize. But are you seeing any cool or interesting innovations in that space that are really controlling costs? Where would you say that's, from a, innovation space, what's interesting there?
Yeah, we talked to a lot of different companies that are working to innovate more typically around cost in that space. I think there's been kind of the, uptick in the transparent PBM type of approach, kind of piggybacking off of like Mark Cuban's company. So I think that there is demand for that, but it does seem like for most employers you're talking to, they're still kind of working with like the large, 3 PBMs that have kind of that historical, footprint. But I do think that there is demand, and different companies, depending on kind of their risk profile, are maybe starting to look for alternative solutions and maybe being a little bit more demanding, either with the PBMs that they're that they're contracting with, or looking for alternative solutions that can actually, bring down those prices. Because I think that, to your point, like there's just not a ton of trust right now with the PBMs. And so just again, depending on the organization type and what their risk profile is, I think that some companies are looking to do something different. But to your point, I feel like that may move somewhat slow.
Yeah, no, it is. It's a tough one, in that you've got a lot of just sort of, incumbents, and that's just the way it's been to change it, and even with like Lilly Direct and some of the direct, you for years we've heard about, sort of direct to primary care and what could happen there. And now we have direct pharmacy, happening and what might happen there. And so there's definitely, sort of exciting innovations happening on the employer market, but it's almost like, how does that go through the channels that currently exist to get to actually pass through to value?
Yeah, I think especially like a lot of the larger employers, they just, they don't want to necessarily take a risk on things. So they're looking for proof that this is going to be something that they should invest in. So I think that kind of starting down market and building that, that body of evidence, those outcomes, building up the kind of the client logos and the social proof is important for companies before they maybe move upstream. Because I think that just some of the larger companies, it's going to be a little bit harder to get them to make, the bigger shift, because they probably do have a little bit more risk, right? They can't handle having a program that's going to fail or, create mass disruption across like a very large population of employees and their families.
Yeah. No, absolutely. The risk aversion and, ensuring that it's a valuable and worthwhile investment. Tell me, when you think about sort of the employer market and the digital health solutions marketplace right now, specifically, what are the most, if you had to pick a case study for like this digital health innovation went to employers and, they cracked it, they did a great job, and now, look, everybody's getting it. What are, are there a few or one digital health technology that comes to mind?
Yeah, I think like Hinge Health would be a great one, right? They have done a fantastic job breaking into the employer market. I've been watching MIDI Health a lot lately. I'm interested in women's health. I think it's really interesting. Some of the other, women's health companies have done a really strong job with employers as well. But a lot of these companies, they are spending quite a lot of money on that kind of commercial function to build up within the employer market. Like I saw that MIDI just, closed on a pretty large raise again recently. So, that's kind of an expensive proposition that not necessarily every company has. So we work a lot with companies on, depending on kind of the resources that you have, what would be the best way to maybe deploy those, like that's right sized for their organization. Because I think kind of the companies like the Hinge Healths and people like that, they obviously have very large, commercial organizations that are also very focused on the employer market, and have those people that have the Rolodexes and the experience and really built out kind of these large commercial teams to go after those employers. And I think they also have, kind of the strong story around ROI value. And, you see them everywhere. Like they're literally everywhere. They're at all the conferences. Right. They're very active on LinkedIn. Everybody knows their names. They are working very effectively through the consultants and the brokers. So, I mean, it's hard to miss them, right? They've created some of these categories and then they've made a lot of chatter about it and they've done very well as a result. But that's not always like an option for every company if they haven't raised that amount of money, right?
Mm-hmm. Yeah. Well, and it's like with the diversity of the market and the size of the market, it's expensive to actually, break into it for sure. So we like to ask always in terms of just big picture challenges and big picture technology challenges or healthcare challenges. What's one, as we all choose healthcare because we want to fix it and we want it to be better. What's, your big sort of, if you could change one thing in healthcare or solve one challenge that you would want to change?
Yeah. Yeah. So as I mentioned, I'm kind of a big person on nutrition. I've been, following the food as medicine movement. I've been involved in that movement and worked with some companies in that space. So I would love to see more traction in that space. I think that it would be really cool if some of those companies could really figure out how in a scalable way to utilize technology to deliver access to higher quality food to, kind of the broader population. So not just, those people that can necessarily afford it, but how do you kind of integrate social determinants of health and everything else to kind of solve those problems for the broader population that we have here. And then also, educating people. But I think, there's still so many food deserts in the country, so many people without access to knowledge, and then, the actual healthy foods like fruits, vegetables, fresh foods. I think that would be what I would choose to solve. And I think that movement's been picking up, but, kind of like we were talking about, they struggle a little bit with proving out at that ROI. Like everybody knows that, like, health is like that. Your health is largely based on the things that you put in your body from a food perspective, but tying that back to the actual outcomes for ROI has been hard for those groups as well. So would love to see that pick up more traction.
Me too. That's one of my favorite areas. And I shouldn't be surprised that there's been growth in it, but I have to say that it was surprising to see the growth and to see, we have examples and folks in New York and, the hospitals that are getting involved. And we did, a long time ago, a series on social determinants of health. And, of course that it's more, it's broader, obviously, and the data there and kind of the tools and it's really just an extension of population health and public health and what's involved. But the food as medicine movement is getting traction, and it's super exciting to see, because it touches everything and everyone. And it'll be interesting to see how it intersects with GLP-1s, because then it's like nobody's eating, but if you just ate healthy food, that would be great.
Right. Yeah. It seems like all these things could come together, but who knows?
It does. And there's certainly a digital application for it, in places of, where the need is, and getting that, food to the right people at the right time when they need it is certainly important. So tell us, when you look at the sort of digital health innovation space, what's one good thing that you see happening that you're super excited about?
Yeah. I think, point solutions get a lot of negative, a lot of people say negative things about point solutions, but at the same time, there's all these companies that are trying to solve and create innovation around smaller challenges that have like a meaningful impact on people. So I've been getting excited just with the different types of companies that are approaching, healthcare from a specific lens where they're trying to solve maybe a specific problem. Like we spoke to a company this week that is genomics for pediatrics. I was like, oh yes, I would love to have more of that. And they're like, but how do we get to kind of the employer space? So I think if there's, opportunities to kind of bring these solutions together, make their procurement easier for employers, make that process easier, then I think that these companies that are tackling small pieces of healthcare could kind of add up to have, meaningful change. So I think it's exciting just kind of seeing the different types of companies that are going after specific challenges and just kind of the energy and passion there.
Yeah, I agree. I mean, and it's funny coming from a place where it was like, oh, it's all supposed to be, connected and cohesive. And we want it to be, to a point where it's like, I don't really care. I mean, I have 1,000 apps on my phone and I have 1,000, I mean, at some point, yeah, it's too much. But in reality, that need for it to be all in one place, I think has kind of gone away. Well, maybe because it is all in one place, it's all on your phone.
And what you care about is not necessarily like what like my husband cares about, right?
Of
So
course.
like,
Right.
like everybody needs things that are personalized for them, right?
It's a trade-off between customization, personalization, and a bit of convenience, and I think as things are becoming easier in terms of the tools talking to each other, that point solution problem isn't as big. Now, from a procurement standpoint, it's still there, but maybe that's where there's a tool that could wrap it all together. And
yeah, that would be exciting.
And make it easier. I mean, and one of the things I've always thought about is, it's like I look at my health insurance, and through the employer, and you're oh well, I want the do I want the Cadillac plan? Do I want this? Do I want that? But they're not really actually offering other solutions that I could buy into. They could pass the cost through to me, but they just become almost a distribution mechanism as opposed to the actual payer, for some of these technology, so for some of these types of tools, that there's an opportunity there that I think is sometimes missed by probably more mid-market. So as those tools become available and the demand becomes higher, maybe we'll get there.
Yeah, I hope so. It'll be exciting.
Well, tell the audience about how to get in touch with you. We have a lot of digital health innovators who are looking to sell into the employer market, and I can only imagine how you could help them. So
awesome. Yeah. I mean, the easiest way you can find me on LinkedIn, my name's Lindsey Kratzer, or you can go to our website. It's sparkhealthadvisors.com. But yeah, reach out. But like I said, I'm active on LinkedIn, and that's generally the easiest way to get a hold of me and kick off a conversation.
Awesome. Well, thank you so much, Lindsey. It's been a pleasure to chat about this. And I look forward to kind of seeing how this evolves, because I think, there's so many organizations around now who are getting involved in, quantifying the value for employers, like the Peterson Health Institute in New York, and, doing a great job of just kind of getting this also out there, right? The discussion of what digital health technology means to employers and what they're looking for in value, and having that discussion at the same time that we're talking about what the hospital, executives and leadership and patients are looking for. Because at the end of the day, if we can't get it to them, then we can't solve the problems.
Absolutely agree. Yeah. Thanks so much for having me on, Megan. It was a great discussion.
Yeah, absolutely. And to our audience, thanks. We hope this conversation has been valuable. Remember to tune in and listen. Until next time, keep pushing the boundaries of what's possible in healthcare. And this is Megan Antonelli signing off for Health Impact Digital Health Talks. Thank you.